So we'll be presenting data from a large-scale, long-term clinical trial called the Physicians Health Study 2 that tested a standard common multivitamin for the prevention of cardiovascular disease. So more than half of U.S. adults take multivitamin supplements, and multivitamins are the most common one taken by at least 1/3 of U.S. adults, in fact. And there's been a lot of basic research that has suggested that some of the components of multivitamins might, in fact, reduce the risk of cardiovascular disease. But the observational studies that have looked at that question have been actually quite inconsistent regarding an inverse association between multivitamins and a low risk of cardiovascular disease. And in fact, there's actually no large-scale long-term trials at all that have tested whether a common multivitamin might have any role in the prevention of cardiovascular disease. So the Physicians Health Study 2 is actually a function of the Physicians Health Study 1. The original Physicians Health Study was a trial of aspirin beta-carotene that started 30 years ago, and that morphed into the Physicians Health Study 2. And the Physicians Health Study 2 is a combination of participants who were in the first trial, as well as 7,000 new physician participants who were enrolled. So the Physicians Health Study 2 is a randomized, double-blind, placebo-controlled factorial trial that's conducted entirely by mail among 14,641 male physicians aged 50 years and up. And in the PHS2, we evaluated whether the long-term risks and benefits of vitamin E, C, and in particular for this presentation, a multivitamin, had any role on the primary outcomes of cardiovascular disease, as well as cancer, which we reported a few weeks back. And then secondary outcomes for the main trial include eye disease and cognitive function. This is just a brief overview of the randomization scheme. Again, phase 1 represents when the original PHS1 participants were brought into the trial. And then we had to invite up to more than 250,000 new physician participants, potentially of whom we got 7,000 enrolled and randomized into the Physicians Health Study 2. And equal numbers were randomized to either take an active multivitamin or a placebo. So this is just a picture of the monthly calendar pack. Again, this is a trial that was done by mail. And these are male physicians and incredibly dedicated to the endeavor of the trial. And in fact, these physicians would take these calendar packs and were incredibly compliant and would take them around the world. They were as well traveled as I think any of you might be. So for the follow-up of the Physicians Health Study 2, the mean follow-up was 11.2 years with a total of more than 164 person years of follow-up. And the compliance is actually quite high. At 4 years into the trial, it was 77%, and the follow-up was actually very, very modest, which is a testament, I think, to our physician participants. By 8 years, it was 72% compliance, and then by the study end, at about 11 years, it was 67%. So our primary outcome, again, was major cardiovascular events, which is a combined endpoint of non-fatal MI, non-fatal stroke, and CVD death. And then other CVD outcomes included total and fatal MI, total and fatal stroke, ischemic and hemorrhagic stroke, then also cardiovascular mortality and total mortality. So this is just your table 1 comparing participants who were randomized either to the active or placebo multivitamin. Randomization worked, but one thing that is worth noting is that these physicians were quite healthy. So there was very low prevalence of current smoking at the start of the trial. Only about 3.5% were current smokers, but a lot were actually former smokers. A lot of them exercised, a lot of them were taking aspirin, and also had pretty good diets. So going in, they were a fairly healthy group of men aged 50 and up. So this is for the primary endpoint of major cardiovascular events. You can see these are essentially overlapping lines, and what this basically conveys is that there was no effect of a multivitamin over a decade of treatment and follow-up on the primary endpoint of major cardiovascular events. And further, if you look at the endpoints of total myocardial infarction or total stroke, there was a similar lack of effect of a multivitamin in having any effect on those endpoints as well. And this is the main summary table. So again, for the first line looking at major cardiovascular events, there was no effect over the course of treatment and follow-up for a multivitamin in cardiovascular disease. The same can be said for total MI and total stroke, as well as the various stroke subtypes. It is worth noting that there was a borderline significant reduction in MI death. That was a 39% reduction, but the number of endpoints were actually quite small, so we take that with a grain of salt. And then for cardiovascular death, there was non-significant reductions in cardiovascular death and also a 6% reduction in mortality that wasn't significant as well. I'm going to skip through this for the purposes of. So one other thing we considered is effect modification, thinking about baseline characteristics to see whether particular subgroups might be at higher or lower risk of developing cardiovascular disease for those who are taking the multivitamin. And although we did find a slight borderline significant effect for age, by and large, if you look across all major effect modifiers such as age, smoking status, current aspirin use, history of high cholesterol, history of diabetes, history of cardiovascular disease, plasma total cholesterol, as well as fruit and vegetable intake, there was a similar lack of effect in each of these subgroups of individuals. It is worth noting that despite the lack of effect that we observed for our primary endpoint of cardiovascular disease, we did previously provide results a few weeks back looking at the other primary endpoint of total cancer, in which we found actually a very consistent reduction in total cancer for taking a multivitamin over the course of a decade in this group of men. And there was an 8% reduction in total cancer. And actually, if you take out prostate cancer, for which we found no effect, we actually found a stronger effect when you have the endpoint of total cancer minus prostate. And if you took those men who had a baseline history of cancer, there's even a stronger effect there. So with that in mind, in conclusion, PHS-2 is still the only large-scale randomized trial that tested long-term multivitamin use, finding no effect on major cardiovascular events in men. And the main reason for taking multivitamin still remains to prevent vitamin and mineral deficiency. However, the decision to take a multivitamin should also consider its modest beneficial effects on cancer, despite the fact that we didn't find an effect on cardiovascular disease in our trial. And we will be providing additional trial results for the effects of a multivitamin and other important outcomes, along with extending follow-up of the PHS-2 cohort. Thank you.
Thank you very much, Dr. Sesso. The last paper in our late-breaking clinical trial session focusing on prevention of cardiovascular